All right, here we go. So I am Erin Prendergast. I work at the Art Gallery of Ontario, and I am here to talk with my friend, Dr. Khaled Almilaji, on the topic of hope and optimism in perilous times. And we're going to talk about hope in a very broad, actionable sense of advancing social good, because in order to make a better world, we must have the ability to see a better world, and that takes optimism. So, Khaled, I'm just going to introduce you and tell our viewers about a few of your accomplishments. You are a Syrian-born and trained medical doctor with ear, nose, and throat specialty, or the neck up, as you once told me. You are the founder of the Canadian International Medical Relief Organization, which provides much needed medical supplies and training to frontline medical healthcare workers. And Bill Gates is one of your funders. You were awarded the Meritorious Service Medal, and here's a picture of you here receiving your award from Governor General Julie Payette for civilian efforts in providing medical relief and educational training to disaster-stricken areas around the globe, particularly Syria. You are a recent graduate of the Executive Master of Health Informatics from University of Toronto. You currently work at the Center for Addiction and Mental Health Hospital in Toronto. You reside in Toronto with your wife, who's also a medical doctor, and your young daughter, Daria. So a few years ago, you and I began a friendship, and it started right here at the AGO when I invited you to lunch after I read this article about you in Toronto Life. I was so inspired about your humanity and your ability to continue to believe in the common goodness of people that I just reached out on you on a whim. And it's been so lovely to get to know you over these past few years. So I've got a few questions for you. Khaled, you have been wrongly imprisoned, tortured. You have had to flee your homeland. You've been separated from your parents and siblings. You've endured the Trump ban, and yet you are one of the most hopeful and optimistic people I have ever met. Can you tell me, how did you acquire this outlook in spite of all the obstacles you've had to overcome, and how do you sustain it?
Hey, Erin, thanks for having me, and thanks for all the amazing work that you and your colleagues in the AGO are doing. And it's an amazing idea, actually, to share and to have those sessions with different people. It's amazing. Thanks again. Yeah, I think optimism is part of like everybody's life, and it should be there. Maybe for my case, it's a part of like a family tradition. It's a family culture, or yeah, I think my family is part of the reason that like I was like. Honestly, it's not like only that's like a personal thing. It's like a tradition in the culture in the whole family, and it goes with it. Yeah, and I think I saw it and clearly in the crisis in the war. Yeah, definitely you can see people who can see the light at the end of the the tunnel, and because we went through really catastrophic like. Circumstances. I'm not the person who can talk about this. There are many other people that they faced horrible conditions, and they are still facing this. And apparently, many of them they still they are still surviving, and I can see we can see where the optimism can play like a really very crucial role in resilience and survival. So yeah,
absolutely.
This is, that's it.
That's great. Well, it's great to know that that's something in your background, both in your family and your culture. I think it's extraordinary to have that outlook. So the topic of vaccinations is very much top of mind right now as the world struggles to contain the coronavirus. Vaccinations are key to containing and putting an end to many illnesses around the world. Could you share the story of how you spearheaded a program to inoculate over 1.5 million children in war-torn Syria with the help of about 8,500 healthcare workers on the ground? How did you guys manage that in the middle of a civil war crisis?
Yeah, I was heading a small team with some recognition of a couple of governments that this team is responsible of coordinating some humanitarian operations in the areas where the most of the war is happening, and it's not the areas under the Assad regime that in 2012, 13, and 14, and one of our priorities were actually to collect data and to make sure that those who are trying to help, they have the right data so they can really help in a more efficient way. Mm-hmm. We know that the resources are very limited, and data are very essential to prioritize, to know where to respond, what and who and when. So those information, we couldn't have enough information about those specifically for the communicable diseases particle part of it. So we launched. I co-founded a program that it's a surveillance system that monitored the communicable status in the area, or mm-hmm. the epidemiological status in this region, where more than 11 million people reside. Luckily, after we launched the system, we trained people. We received some support from CDC by training, technical support, some material, some fund from a couple of governments, and luckily at the right time we caught the first couple of cases of polio in eastern of the region that we are operating in, and. So you have to initiate, you have to put the things together. We have to know who is doing what and whom to target and who's responsible to help you. And with some advocacy from people who are really interested, from volunteers actually, people who are in Europe or in the US, but they are concerned about what's happening and they want to help. They helped us, and this volunteer role, with the small information from here and there, we knew who to target and what to do to get this enough support and enough advocacy to roll out this big campaign, actually, to provide resources, training, money, part of it from mainly from the Bill and Melinda Gates Foundation and other couple of governments and institutions. I was heading I was the director of those campaigns and our team that handled other couple of other initiatives, and actually the main thing that made this happen and stop the circulating of the virus in 2014, early 2014, actually the New Year night, I was at the borders delivering the first shipments of the polio vaccines. Wow. After a lot of preparations in almost 8 weeks. So we launched the campaign. It's 6 days. You have to vaccinate 1.4 to 1.5 million kids under 5 years, door to door. So you have to go to their houses, knock the door, take vaccinate every kid under 5 years, tally sheet all the kids that you missed. Just make sure that all the documentation is there. And we stopped and this was happening under the barrel bombs, under the bombing, under all the risks and horrible circumstances.
And by volunteers primarily.
Yeah, absolutely. They were primarily they were volunteers, 8,500 volunteers all over the north of Syria. So without optimism and dedication, actually, and the belief that they are doing something and they want to succeed in it, you will never find anyone to do this. International NGOs, they will never allow their staff to get beyond in Syria in these like circumstances because of all the bombing and targeting of hospitals and health workers. They will never send their people. They will keep support like health facilities and staff, but national staff, Syrian people. So like
It's
you can
amazing.
imagine, yeah, you can imagine the circumstances where like hundreds of health facilities and were targeted.
Mm-hmm. And it just once again reveals the importance of volunteers and the frontline people who are willing to risk their own lives to help others. Often
Absolutely.
when we think about polio, we think it's an old eradicated disease, but obviously it's still alive and well. When I think about polio, my mother had polio when she was a young girl, and she was able to overcome that. And with the vaccination now, that's helping to save so many lives. That's incredible, Khaled, that you were able to do that with your team.
But polio was limited to Nigeria and Pakistan, I think, and maybe Afghanistan. But like with Syria was like something like very surprising because we just eradicated polio based on the WHO standards for like years. So it was like really frustrating to have it again.
Yeah. Could you tell us what exactly is the Canadian International Medical Relief Organization? I know it's something that you founded around 2014 or something like that with a couple of your colleagues, but you've talked to me about work that you all do to support underground hospitals and provide medical equipment, etc. Maybe you can tell us a little bit more about what that organization does.
Actually, this will take us again to the volunteering and the importance of volunteering and self-initiated initiatives, right?
Right.
So I was at the borders. We are trying to train some medical first responders that they are like they evacuate mass casualties from like locations where like barrel bombs dropped. So we were there. Some of volunteers came from like overseas to train just because they paid everything. They took like days off from their work. They paid their tickets and their hotels and everything, and they came just for the purpose of help. So I met a couple of amazing people there, Mark and Jay. Mark is a paramedic and with a policeman background and amazing volunteer and educator. Jay is a pediatrician and amazing man working in Humber hospital here. And they were there and they were trying to help people to train, and they already brought some stuff and to train the people, the first responders who crossed the borders to Turkey to train them. So they were there, they trained the people. They were so excited, they were so full of optimism that they can do something, and I liked them. And I kept communicating with them after they left back, and they came back again with actually this time they brought some like CBC group with them, and we went in Syria actually, and we did the same, but we trained those first responders in their hospitals, in their centers inside Syria to train more people who didn't have like any passports or any documents and actually to save their time. It is a risk over those people who are coming from Canada and North America and Europe, but they also wanted to do something. So we went a couple of days inside Syria to Aleppo, to the suburbs of Aleppo. We trained the first responders, health workers in a couple of hospitals, and we went back to Turkey. This is where the idea of CIMRO started to actually launch a charity or a non-governmental organization in Canada, based in Canada. And I'm just like let's say a non-formal co-founder of the organization.
Right.
Jay and Mark and a lot of others are the founders, the formal and legal founders here in Canada. I used to used to work here. I used to implement projects in Turkey and in Syria. And we launched also, I launched formally a legal entity in Turkey, has a similar name called SIMRO, actually. It's
Right.
Sustainable International Medical Relief Organization. It's some kind of like a twin organization. We have our own donors as well, and our own projects. Yep.
That's great, Khaled. Tell me, how did you end up in Canada? Tell us the story of the Trump ban, and we're so fortunate to have you here in this country. But I know it was a little bit of a journey for you.
I'm so fortunate. I'm so lucky.
Okay.
So basically, yeah, I was seeking to get some kind of like a formal academic degree in public health. And
Yes.
I got a scholarship in Brown University with help from friends.
In Rhode Island.
Yeah, exactly. And I got the visa after like a long vetting, and I went with my wife to Rhode Island, Providence, and started my master's degree in Providence in Brown University in August 2016, and I finished the first term with a good understanding, like at the end of the year. Through this term, I was communicating and managing remotely my team, and then I had to go back. This is like it's like 6 months, and I've never been away from them like for this time, like this period. A lot of people, they told me like it's not a good idea to leave the U.S. It's always like a risk that you will come back and they won't let you in.
And this is when Trump became president.
Yeah, it was like exactly before his inauguration, like 2 weeks. So, or 1 week maybe. Anyway, so I like the New Year night, I traveled from New York, JFK airport to Turkey. I spent a week, and then I tried to travel back, and they told me that the airlines told me that like the Americans, they just revoked your visa, and I communicated with the embassy and tried to know why, and it's already like it's just like a Syrian who traveled to Turkey.
Oh,
So anyway, so it was like I've already vetted like multiple times before I got my visas, and they know me. So anyway, I spent a couple of months away from my pregnant wife. She was there in Providence. We really wanted to continue what we have started. So she stayed in the US. We really hoped, and we advocated, and a lot of amazing people advocated with us in America, in Providence, in everywhere. There was a huge campaign of advocacy to get me a visa. But it took a time, and my amazing group of Canadians, they volunteered again to advocate in Canada, and I got like an amazing offer from a donor in Toronto to cover my expenses if I get like approval or admission in one of the schools.
That's amazing.
Toronto.
Canadians to the rescue.
Always. And yeah.
That's great. Well, we're so happy that you're here. Can you tell us, what is your job at CAMH?
Yeah. So basically, while I'm on the board of like my humanitarian organization, and this is like it's not like a commitment. I mean like a full-time commitment. My full-time commitment is with CAMH. I work in the project management office. I'm not practicing medicine here. My wife is trying hopefully soon to get her like tests done and apply for the medical training. For me, I'm good with doing the things that I love, which is like more public health informatics, and this world where I spent like almost now like 9 years, and I love it. So project management, health informatics, this is where I spend most of my day. And CAMH, I work in the enterprise project management office in EPMO in CAMH, and I focus on I work with the chief medical information officer there. She's an amazing person. She's so enthusiastic, so optimistic. So that's why I love, part of why I love this job. And our job is to focus on physicians' burnout. So we want
Yes.
the physicians' wellness. We want them to deal with the screen and the electronic medical records in a less stress and in a more efficient way. Spend less time, more time with the face-to-face with the patient, but with a more efficient system. This is what we are doing there.
Yeah, great. Well, thank you for that important work, Khaled, that you and your team are doing at CAMH. So my last question is, having overcome many challenges, we are in the midst of a global crisis, a global pandemic. And for some people, including younger people who haven't experienced big challenges like this, it can be stressful, and some people might be feeling anxious. What advice would you give to people who are feeling anxious, including younger people perhaps, who have never experienced a difficult moment like this before? Any advice for them?
Yeah, absolutely. Like wellness is very important now. We expect that like the mental health it is impacted now, and people, they have just to know that like the routine and the norm of their lives, it could be interrupted by like this like crisis, this outbreak, or something else. It could be on the public health, and could be on the population level. It could be on their individual level, right? And they have just to take a breath and think positively, take a step back and think about like my life and what's my goals and my objectives for the next day, week, month, couple of months. What are the options I have, and where I need to focus on. I don't want to distract myself in this like critical duration. So put your priorities. This is the things that I need to do, and put important focus on your health, your mental health, your wellness. Don't end up like after like spend too much time on like in front of computers, screens, static in your place and on your chair. Be careful. And because this will accumulate, and you will get into a zone where it's really like bad. So take care of yourself. Make sure that you have a small plan for your life, for your, or even for your daily life. I'm not talking about business. For your daily life, make changes. Put like plan that you have to do something different every couple of days. You have to do, of course, the exercise. The never give up exercise. Socializing by like calling and checking on people, on family and friends. Just make sure that you are, yes, the norm is different now, but like and we don't think about like when this will end. This is the most important. Don't think about when this will end. Think about like, while I'm in here, what should I do?
That's
And
good advice.
yeah, this is very important. And just make sure that eat well, eat healthy, and exercise. This is the most important.
It's true. You're absolutely right. I find myself walking up and down the stairs in my condo just to get a little bit of exercise. But it's good.
But we're talking about talking about optimism, volunteering. Yeah, we ask people to stay at home, but we don't know that we know that at the same time, many people, they don't have the luxury, and they don't have the luxury of the idea of being able to stay at home. So basically, some people, they have to go out because they have to make some money to eat. They have to go out because they don't have someone with them, even if they are elderly, to go and to get them some food or whatever. So the different challenges that face the ability of people, of vulnerable populations, elderly, or people who are like compromised, that they cannot step out of their doors to get something. Here, where like we really need also to put some of our time and plan in this time to show like our Canadian way, right? Our Canadian way of living, that take care of yours, the small zone around you. This includes like your neighbor, people whom you know. Just put a paper and pen and just like list those people whom if you didn't list, no one, they will be on no one
It,
other lists,
I agree
right?
100%. It's really important that we take the time to check in with our neighbors, and especially
Absolutely,
the most vulnerable people who live in our
absolutely,
neighborhood. Can we
absolutely.
get them groceries? Can we drop things off at their door? Just quick little check-ins by quick phone calls or quick texts. Zoom calls are fun because you can actually see the person, or FaceTime. But I agree. We are all here for each other. And I think the Canadian way of checking in on each other is really the right route.
Even if they don't know, like someone really, if they can think about someone now who is in need, just contact any organization. They need a lot of people. They have materials, they have boxes, they have food, they have a lot of aid they want to distribute to a list. I tried to do this, and it was super easy. They add you to a room where every couple of days they distribute some kind of a call that they need someone to distribute a couple of boxes to a couple of families, and you
Yeah,
just pick the area that you prefer, and you will spend like 1 hour and a half. It's very easy, super safe, and you will just get the boxes, drop it in front of someone, and call them just to get their box, and that's it. Leave.
absolutely. I think it's really important that we take time away from ourselves to look into these various volunteer opportunities to help make sure that the people that we live with in our city are going to get through this.
Absolutely, absolutely.
Thank you so much, Khaled. I really appreciate a little bit of time with you. You're an incredible person, and I wish you and your family well. And I can't wait to have lunch with you again at the Art Gallery of Ontario very soon.
Thank you so much. And I think there was the Nurse Day. So happy Nurse Day to
Yes,
all our nurses, and thank you to all our health workers, our heroes, our frontliners, everyone. Thank you so much. They are doing an amazing job. We really appreciate all of their work. So thanks again.
that's true. Thank you. Thank you all, frontline and healthcare workers everywhere. We really appreciate it. Thanks so much, Khaled.
And thanks for having me, Erin. Thank you so much. Bye bye.